Doc Talk, sponsored by Geisinger Holy Spirit.
The fall season doesn't just come with changing leaves and colder weather, but also an increased risk of getting the flu. And this week's Doc Talk, CBS 21's Ed Russo takes a closer look at how you can stay above the weather.
The flu season typically picks up steam in November and peaks in February. According to the CDC, the annual number of illnesses has been as high as 49 million, with 960,000 hospitalizations and 79,000 deaths. The good news is that you can easily find ways to avoid capturing it.
To help prevent infections, hand sanitizer does work. Washing your hands with soap and water works. Certain viruses you cannot prevent, but the flu is definitely a preventable infection if you get the flu vaccine.
Germs can spread very easily, especially with children, because they tend to touch their ears, eyes, nose, and mouth. Hand washing seems trivial, but teaching kids the right technique goes a long way in preventing transmission. Have them practice washing their hands underwater, have them apply the soap, and then have them self-scrub for a solid 20 to 30 seconds. This is when sanitizing becomes most effective. Then have them rinse. Sometimes you know you've already been exposed to the flu and may not have yet developed symptoms.
Well, once you're exposed to the flu, it's probably too late, but if you have not come down with the flu yet and you know that you were exposed to the flu, definitely there are antivirals that you can take prophylactically.
Prevention is key. And even if you're feeling well, you can still carry the virus, hence the importance of sanitizing, especially if you're more at risk.
If you truly believe that you're at risk for the flu and decide not to get the flu vaccine, some companies will make you wear a mask during work hours. That might be the best, but I still think the best way to prevent the flu is getting the flu vaccine.
For this week's Doc Talk, I'm Ed Russo for CBS 21 News.